I was in the back of a pickup truck when my friend fell asleep at the wheel. I knew something wasn't right. I couldn't really feel my legs. Well, the ambulance took me to Wolfsburg Hospital, Sydenham, and then they rushed me up to the London Health Sciences Centre.
Here at Victoria Hospital, Justin had the specialist care he urgently needed and was immediately referred to Dr. Chris Bailey and the surgical spine program.
When Dr. Bailey came in and told me the extent of my injuries, he mentioned that I had a fractured vertebrae, and there's a small piece of vertebrae stuck into my spinal cord, and he said my chances of walking or regaining anything back was about 1%.
I came down and saw him, and I had seen his imaging, his x-rays before, so I knew that he had a substantial problem in his spine. And after I saw him, I could tell that he was not able to move his legs at all. He was paralyzed from his injury.
Dr. Bailey and his team spent the next several hours attaching rods and screws to stabilize and realign his spine.
Someone with a spinal cord injury and a big injury to the spinal column is critically injured. And there's a lot of bleeding involved with the surgery. And the surgery takes a long time.
With doctors thinking Justin had a complete spinal cord injury, all family and friends could do was wait for Justin to begin to heal.
A couple of days after my surgery, Dr. Bailey came in. Every day, actually, he'd come in and say, try and wiggle your toes, try and wiggle your toes. And every day I couldn't do it, and then one day I just I felt in my head that I had some kind of movement.
Grabbed all the nurses, because we all sort of thought that it was a very sad story for him, that he would never be able to move again, his legs, or feel his legs again. And I said, Justin, move your toe. And he moved his toe, and everyone was really happy.
When my mom was up the one day, I said, I got a little trick for you. And I just pulled the blanket over and started wiggling my toe for her. And I think she started crying that day.
Still, Justin wasn't out of the woods and would spend several more weeks in the hospital. Physiotherapy began at nearby Parkwood.
They were kind of preparing me for life in a wheelchair. They pushed me pretty hard over there, and I ended up walking, or beginning to walk, a couple months into my rehab. And my goal right from day one was my mom's birthday. I was going to walk for her birthday in September, and somehow I got there. I don't know. There's somebody looking over me, that's for sure.
The chance of him having the recovery he did was less than 1%. So he beat the odds.
With this kind of spinal cord injury common in young men like Justin, usually due to traumatic events like car or sporting accidents, Justin was indeed one of the lucky ones.
Really, the big questions in spine research is how to cure spinal cord injuries so that everyone can walk like Justin does.
Couldn't have done all I've done without the nurses and doctors and everyone involved here at the London Health Sciences Centre.